Justice. He's going to be hanging out with us as we go over the topic of pacifiers. So pacifiers can be an interesting topic to come across because they are so widely used. And a lot of people will say pros, a lot of people will say cons, a lot of people will say so many different opinions and stuff about it. So today I am literally just going to be hitting on the evidence of pacifiers that we currently have in literature, and then I will be talking about my own experience at the end. So if you do not want any opinions, just skip that ending. Is that right? And we're ready. So, pacifiers. So I'm just going to quickly start with the cons because the cons are a much shorter list than the pros relating to certain infant ages. So, with cons, we have nipple confusion. Now, there's not a lot of evidence in literature for nipple confusion. I have my own experience with that I will talk about at the end of this video. The next is early cessation of breastfeeding. Again, not a whole lot of evidence with early cessation of breastfeeding, but there were links to shorter durations of breastfeeding when pacifier use was commonly used. Risk of otitis media. So this is a risk that is more with the age group of 6 months to 2 years. So kind of older infants and toddlers using pacifiers. And the reason why is the reflux of nasopharyngeal secretions that happen when pacifier use is done during those ages. The next is dental malocclusion. Now there's quite a bit of evidence for this. It's mainly relating to like bites of some kind, like overbites, underbites, different kinds of teeth issues that pacifiers have when a child gets older. This is mainly for the age groups of 2+ years old. And then infection. Not a lot of evidence regarding infection, pretty much because it hasn't really been researched so much. I would assume the connection is mainly due to pacifiers falling on the ground, then you putting it in the baby's mouth. So common tips with that is just clean that pacifier, don't put it straight into the baby's mouth. So pros. Pretty much all of these pros are related to pacifier use for a preterm baby. There really is there's a couple that I'll talk about, but pretty much all the pros are for preterm babies and not for full-term newborns and infants. So the first is a baby with low birth weight, then a premature, kind of what I said, a premature infant. It helps with oral stimulation development. So to go back a little bit so we can understand why it would help with oral stimulation development is we're talking about their reflexes. So sucking starts developing around the 8th week gestation, which is pretty early on in utero. But it doesn't start becoming mature, that sucking, breathing, swallowing reflex until 36 weeks to gestation. So when a baby is born early, like 32 weeks or 30 weeks or even earlier, it doesn't learn that reflex. It doesn't have that reflex. So you can't have a 30-week-old and then usually just put them to breast and they're going to start eating great and doing that sucking, swallowing, breathing reflex well. No, usually it takes some time to learn that. So pacifiers in that context can be very useful because most of the time when these babies go to NICU, they're going to be fed through a tube through their nose. And giving them the pacifier as well during the NICU times can help stimulate that oral stimulation so they can start maturing in that reflex, that sucking, swallowing, breathing reflex. So what it's called is NNS, so non-nutritive sucking. This is really important because it has shown to increase oxygen levels, decrease heart rate, like when a baby's tachycardic, so they're stressed or they're crying really hard or they're upset or they need something, and giving them a pacifier can lower their heart rate to a good place, not lowering it like it's too low, but to a good place and increase their oxygen levels. It also improves glucose, and it does that due to the vagus nerve stimulation caused by the pacifier, what it does is it decreases the somatostatin hormone and increases gastrin secretion when it stimulates that vagus nerve. I know that's a lot of patho, doesn't really need to know to the cellular level of what it does, but what it does is it does improve milk absorption and digestion. That all of that breaking down is it increases milk absorption and digestion through that vagus nerve stimulation that the pacifier does with a premature little baby. It also promotes behavioral organization. Now, all of these pros are related to the premature infant. It helps with soothing, time spent sleeping, improved alertness, and all of that results in a decrease in energy consumption. So if they're at risk for hypoglycemia, risk for losing too much sugar, then using a pacifier helps calm them, soothe them, so they don't use as much energy with different stimulation, with crying, with being upset for any reason. And it also is useful, and this is useful at any age, whether it's premature or whether it's a term infant, when a mother cannot breastfeed. A baby cannot come to breast for some reason. And those reasons could be related to a mother's medication usage, if she's on drugs of some kind, whether they're prescribed or not prescribed, and it's not recommended for an infant to drink breast milk with those drugs in the system. That's pretty much the main reason, but there are other reasons that it can be used beneficial when a mother cannot bring the baby to breast. So some positive promotions for infants of any age that are full term and not just preterm is it does provide comfort. And this is really important, especially when we are doing some kind of test on the baby, whether it's circumcision, whether it's giving them medications, vaccines, or anything like that. Giving them a little passy with a little, sugar on it, not normal sugar like table sugar, but hospital, what you'll get in the hospital, or putting a little bit of breast milk on it. Can be really beneficial if the mother does not want to put the baby to breast during the vaccine or medications, or whenever that baby may need that kind of soothing during those times. Another positivity is SIDS. Now, there really isn't a lot of research on it helping with SIDS, but it did show a small percentage decrease with babies who used pacifiers, mainly in conjunction though when mamas and daddies were doing other things like not smoking or safe sleep practicing. And we really don't know exactly at the moment why pacifiers for sure would decrease the risk of SIDS. There's a lot of good theories out there that I won't be breaking down into this video, but it still has shown a decrease. So the AAP says, you know what, if you want to use a pacifier to decrease the risk of SIDS in your infant, then we recommend adding the pacifier about after 1 month old. And the reason why is at that point, breastfeeding has usually been established. So at 1 month, breastfeeding usually will not be at risk. The baby will have the positive effects of decreased risk of SIDS, as well as SIDS peak time is usually, it depends, but usually between 1 to 2 months to 4 months, sometimes 5 months, depending on the research you are looking at. But usually that 2 to 4 month mark is the greatest peak of SIDS. So, other few things I wanted to mention is when to use a passy. So, after feedings is recommended, so it doesn't affect with breastfeeding at all. Also using it maybe to go to sleep, but to make sure not to reinsert it if the baby has popped it out after falling asleep. If they're asleep and they've popped it out, it doesn't need to be reinserted into their mouth continuously or anything like that. Another thing is to avoid ad-lib use. I know that may be hard whenever a baby's crying and you're just getting, frustrated and upset and you can't figure out what's going on with your baby. I do have a video on how to calm a crying baby that you can see on my profile that may help you, but I can totally understand that frustration. But it is recommended not to use it at any time, just specifically after meals or at bedtime. And then it is recommended to wean at 6 months and at least 14 months to prevent speech impediments. I don't really know so much about what kind of speech impediments and may cause, but that was a risk factor that was mentioned in the research literature. Now, for my own opinions about pacifiers. So if you don't want your own opinions, turn off the video now. I followed the rules about not adding pacifier use until 1 month of age. Now, I did give my baby literally to the day of 1 month. I knew my breastfeeding had been established and my breast milk had been regulated because you can feel it. And the baby had a very, not regular, I wasn't scheduling the baby's feedings, but I was noticing he ate around the same times and very often every day. He was eating about 14 to 16 times in a 24-hour period for the first 2 months of life. So I was pretty confident he was doing good. He was gaining a lot of weight, 1 pound a week. So I introduced the pacifier at 1 month, but it was so bad. I used it like for 1 day. I used it after feedings for soothing because he was having a lot of gas pain at the time, so he was really grumpy, and I was hoping it was going to help him with that. And but I would feed him after using the Passy in that day and the next day, and he would start breastfeeding so badly. He had that nipple confusion that we don't have a lot of research on in the literature to say that it's definitely a thing, but I did experience that, and I noticed that with bottles too. And that caused me to exclusively breastfeed for quite a few months because just that pain of him kind of relearning to breastfeed was just not worth it to me. So I experienced that. I know not every baby does. So that is just something you'll have to see and check out with your own little infant if you decide to use a pacifier. Right? And actually, at this point, he will not use a pacifier. He does not like pacifiers. He's 4 months old now, and he's never been a fan. He loves mommy much more. So that is something that I've just experienced. So I don't have a lot of experience with Passies. I tried it at 1 month, 1.5 months, 2 months, 2.5 months, and it constantly was a nipple confusion issue. And I noticed that with the bottles as well. So, but anyway, that is all about pacifiers that I found in the literature. I will have the literature I looked into in the description below, so you can check that out if you want to check through the research yourself. I hope this video helped you with your pacifier journey, and good luck, and I hope to see you in the next video. Bye!